Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today, Dr. Hazel Cebrun. Good morning. Welcome to the show.
Good morning. Thank you for having me.
So you work for Synthesis Health, right?
I do.
All right. And today we're going to talk about navigating the basically emergency room. It wasn't that long, I think, because I had my trip to the emergency room, and they're never fun. And so never at all. But for our program today, we're going to be talking about taking seniors, somebody who's older, having some difficulty. And so when you're taking a senior or an elderly person to the emergency room, what kind of things should they bring with them? What should that caregiver have when they come to the emergency room?
So I think one of the most important things about navigating the emergency department or preparing for a trip to the emergency department is make sure that you have a list of all medications, an up-to-date list. Make sure you have a list of all allergies that a patient may have. It's helpful to have a list of their physicians, with or without phone numbers. And it's important to bring patience because you never know what to expect. The thing about the emergency department is even for us as providers, it's unpredictable. So one minute it may be completely empty, and the next minute we could be completely overwhelmed with patients. So just knowing that it's never the goal to have anyone wait. It's never the goal not to take care of anyone quickly, but sometimes things happen. So just to know that the emergency department is a very unpredictable place.
So I can't imagine no one on watching our show has never been to the emergency room and could probably confirm that one. And so
exactly.
But what kind of things should somebody expect? So that way they kind of have an idea of what's going to occur, when someone's brought in, especially seniors that are having difficulty.
So I think the first thing you should expect, you're going to be assessed by someone in the front who, of course, there's the obligatory paperwork and all those things, but you're always going to be assessed by someone clinical who kind of gets an idea for how sick, how urgent, how emergent the condition may be. So even if you don't realize it, that may happen very quickly. It may happen in a few seconds. It may be a more formal exam, but there's someone kind of keeping an eye on your vitals, looking at you to see how quickly this person may need to come back to the department. Because when you come into the emergency room, I'm sure most people know you're seen by how sick you are, not necessarily how the order in which you arrive in the department. So someone may arrive after you and may be seen before you. You may arrive after someone else and you may be seen before them. But it's all done in the order of urgency and how quickly that person needs treatment.
So to make sure that you can do everything you can, hopefully, to kind of get in and get out without, having a whole lot of stress, because I know it's very stressful to go to the emergency room. What kind of tips do you suggest that for, like an efficient visit, something that makes it at least easier on the people coming in?
I think one of the things is to communicate to the staff exactly what your concern is. So sometimes in the emergency department, starting at the beginning of the story is not necessarily the most efficient thing. You want to let the staff know exactly why you're there. So for example, starting at the beginning of someone's medical history may not convey to the staff exactly what made you get up and come to the ER at 3:00 in the morning. If you say, I'm here because I'm concerned and I'm having chest pain, I'm here because I'm concerned and my arm is numb, I'm worried about this or that, you're not necessarily telling the staff what they should do, but you are conveying to the staff the thing that made you get up and come in and the thing that you're most concerned about. And sometimes that can convey to the staff exactly what they need to do to treat you most efficiently. A lot of times patients are more used to maybe the doctor taking the lead or the nurse taking the lead, and that is absolutely acceptable. But the more you can convey about what the thing was that made you feel you needed to come and see an emergency provider, it's helpful. It's helpful to us, particularly in regards to what the baseline status of the person coming in is. Are they normally alert and now they're not? Are they normally talkative and now they're not? Are they normally active and that has suddenly changed? Those types of acute changes help us know, okay, something's happening here that we need to pay attention to. If someone's behavior has suddenly changed, those are the things that we need to know to help us help you find the answer that you need. We may not always find the exact answer, but we can often treat the life threat or treat the thing that's most concerning and get the patient to where they need to be more quickly. So that's helpful.
So when I was reading a lot about you, wellness and things are really important, to you. So what kind of advice would you give someone, who cares for a senior? Because you can never have too much.
Right. I think one of the most important things is, obviously if you're caring for a senior, you care about them. I think one of the most important things is listening to the concerns they may have, and understanding that oftentimes the things that may concern a senior most are losing control or losing the ability to direct their care. So oftentimes, particularly in an emergency department, it's important to let that senior speak for themselves. It's important to let the provider, particularly say the ER doctor or the ER nurse, know that the patient has the ability to speak for themselves if they do, so that the patient or the senior feels empowered and they still feel like they can advocate for themselves. I think one of the things that we often do is we may speak to the person who can speak to us most quickly, or we speak to the person who may seem to have the most control of the room. And often the senior gets left out of the conversation. And I think that's a huge oversight sometimes, because sometimes the things that will get a patient or a senior to do what you're asking them to do is to feel like you've engaged them and that they've been a part of the decision-making process. And you also have to realize that they may decide not to do what you want them to do. And as long as they're of their right mind and are able to make competent decisions, that's okay too. So I think one of the most important things is helping them maintain some control and some advocacy over their own healthcare. I think that's important.
I was giggling earlier because I just kept thinking about, me with my grandparents in the room. I did all the wrong things. I'm talking 90 miles to nothing, telling them the doctor everything they needed to know, and then after you breathe for a minute, you turn around and you go, "Is there anything that I missed?" Grandparents go, "No, you took care of it. Thank you." Kind of stuff.
Yeah.
So I was those bad, that bad caregiver at the time. And so there's a lot of anxiety, especially for caregivers. I know with me, it was a lot of anxiety, because, a lot of fear, and things like that. So you tend to take control in an uncontrollable situation.
Mm-hmm.
So I think that's it. It takes a lot of work to kind of, back up and say, I have to wait, let him talk, because my grandfather was very articulate, for, the things that he, needed to, to say, to the doctor. And so, but I just listening to you, I kept thinking, oh, I did this all wrong. I got to work on this.
No, I think there's a balance, right? Because sometimes you do have to kind of insert things to kind of move the care along. But I think you have to kind of pay attention to the room and know when you need to step in and not. I don't think it's bad to kind of direct things when you need to. But sometimes the senior is completely ignored, and I think that that's something we have to pay attention to.
Yeah, that I never tried to do, and so because he would have had my hide. And so what kind of things do you have that would be resources and things like that would be beneficial to seniors today, going to, hitting the emergency room, being ill, and that sort of thing?
I think one of the most important things is, one, the information that you bring, because the more information, the better the staff can kind of know where they need to focus, know what the most important thing is. I think that having your physician information is important, because sometimes, especially if your physician's on staff at that particular hospital, a lot of the preliminaries can be dispensed with, and they can call your doctor directly, and they may direct your care more quickly. You may get what you need more quickly. It may shorten your ER visit if your physician says, you know what, just do these things and then I can see them tomorrow in the office. So I think that's important. I think it's always important to know that if you feel like you're being mistreated or ignored, or if your wait time is too long, there's always the ability to ask to speak to someone, maybe a nurse manager, maybe a charge nurse, just to express your concern. And they may be able to explain to you why the wait is so long. Why is this lab work taking an extra amount of time? Why are we still waiting for x-ray? Why do we not have this report? Sometimes you kind of sit in silence and assume that people have just forgotten about you. And it can feel that way, because 5 minutes waiting in the emergency room often feels like 5 hours. But sometimes sticking your head out and saying, hey, did you get that x-ray back yet? Or did you get that lab back yet? The staff doesn't necessarily mind that. And it kind of helps you feel like you're staying well informed. As much as we try to get back in the room, there's usually something that can easily distract. So just knowing that you have a voice there and you can say, is there, are the things that we've been waiting for back yet? I also think it's important to know that some hospitals have patient advocates on staff that can be called, and they can sometimes listen to concerns that you may have about what's happening in the hospital, both in the emergency department and more commonly if you're admitted to the hospital. There are patient advocates on staff that can come and explain things to you, help you understand why things may not be going the way you expect. So just knowing that you have a voice and you should be able to ask questions without fear of feeling like it will negatively impact your care.
So can you tell us briefly about Synthesis Health?
Sure. So I did my formal training in emergency medicine, and that's where I've spent the majority of my career. But I also did kind of a dual training in integrative medicine and wellness. So I've kind of had this double life where I've also done wellness and nutritional medicine outside of the emergency department. And I wanted to do that because I found over the years that a lot of the things that people were getting care for in the emergency department responded to lifestyle treatments if started early. So Synthesis Health is really my attempt to kind of bridge the gap between acute care and preventative care. We do workshops on wellness. We do workshops on nutrition. We do workshops on stress. I teach breath work, just things that can help reduce the chance of even getting a chronic disease or a disease that may affect you in the future, and also to manage the symptoms of a disease or a process you may already have. I often find that there are these silos in medicine where acute care is on one side and wellness is on the other side, and there's so much opportunity where that should be integrated together. If someone is on chemotherapy, or if someone is taking prescription medicines for their heart, there's absolutely no reason why they can't also benefit from complementary therapies that don't interfere with that. And they often can add to the patient's overall wellness and help them navigate that disease process more efficiently. I think it's important that people know how to eat, how to cook, or even if you don't cook, how to access food that's, healthy. Because I think we underestimate how much diet and lifestyle and walking and exercise plays in our overall health, and how we age absolutely has something to do with that. Staying mobile, staying active. Sometimes we think we have to do a lot, but baby steps really do positively affect, some of the things that we face as we get older.
So if they were looking for you, tell us how they find you.
So my website is synthesishealth.com. It's the same on Instagram and Facebook. My email is info@synthesishealth.com or hcaa@synthesishealth.com. That's how to find me.
Perfect. And so thanks so much. And because that's some great tips. And so we appreciate it immensely, and so glad to have you on the show today.
Thank you for having me. It's my pleasure.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.